We're likely about a month away from COVID-19 booster shots becoming available for fully vaccinated Americans. The FDA still has to give its approval, but Biden administration health officials say a booster shot could increase COVID-19 antibody levels by at least tenfold. Studies have also shown that vaccines are less effective against the Delta variant and that antibody levels decrease over time. So for more on these booster shots, the Delta variant, and the overall response to COVID-19, let's bring in Dr. Rochelle Walensky, Director of the CDC. Dr. Walensky, thank you so much for joining us. And my first question is, given the Delta variant, the breakthrough infections that we keep seeing, what changes are you making in your day-to-day life, if any?
Well, good morning. Thanks for having me. We advised several weeks ago now that people who are indoor should be masking in indoor public settings. We're continuing to advise people who have not yet been vaccinated to absolutely get vaccinated, because those folks are the most at risk for severe disease, hospitalization, and death. And what we're doing right now is planning, looking at the data and planning for booster vaccines, in the month ahead.
You'll be getting your booster shot very soon, or have you gotten it?
I absolutely have not gotten it. I am absolutely waiting for the FDA and the CDC, and I advise Americans to do so. They will, be looking at the data on the third dose, on the booster, and after they give their recommendations, then we will be rolling out booster vaccines, really to those who got it first, those who are most vulnerable to long-term care facilities, and those people who got it first.
Do you think once it is approved, once we start rolling this out, that this third booster will be the last shot that we're going to need?
This virus has been very humbling. So I have a lot of indications that suggest that we may not need another one. But we will continue to follow the science. We will continue to follow the variants. I'm very hopeful that we won't need another one, but we'll absolutely follow the science to determine that.
Following the science, going back with our nation's history when it comes to science and epidemics, I want to talk about the AIDS epidemic, when the CDC started condom availability programs to help stop the spread of HIV in its tracks. Dr. Fauci has said that using N95 or KN95 masks will offer the best protection from COVID-19. So why isn't the CDC working on perhaps dropping hundreds, thousands of masks at pharmacies, at schools, or at transportation hubs, just a massive mask availability program?
That's a great question. Masks are generally available, and N95 and KN95 are increasingly available now. We need to be careful about KN95 and counterfeit, because many of the KN95s out there right now are counterfeit. And what I would advise people is to understand what they need in a mask so that they're able to tolerate it for some period of time. Certainly, if you have a high risk of exposure, if someone who you're caring for has COVID-19, you may want to consider a higher respirator mask like an N95 or a KN95. But it's also the case that those are really hard to tolerate for long periods of time. So if you're taking a many hour plane ride, for example, it will be hard to tolerate an N95 for a long period of time. And so in those situations, we have masks that are ASTM standard, that are multiple layers. You cannot see through them. They have a nose bridge, and they really cover your face quite well. And that also would be a really reasonable recommendation for masking.
Okay, but just to be clear, the CDC is not looking at rolling out a big mask availability program just so that anyone who wants to protect themselves will be able to grab one of those masks, similar to the AIDS epidemic and how we had those condoms available nearly everywhere.
Certainly something we can look at. We are not under the impression right now that mask availability is limiting mask use.
Okay. Another question regarding masks, regarding schools. With school starting, will the CDC have more data on what's driving the current surges in children being hospitalized? And really, what's your advice for parents who are worried about sending their kids back to school, especially in districts where officials aren't following the CDC's guidance?
Yeah, we've updated our school guidance. We absolutely know how we can keep children safe. So among the things to keep children safe are get everyone around those children vaccinated and get those children vaccinated themselves. We do know in schools that the vast majority of disease in these schools, when prevention measures are taken, are really coming in from the community. And then to keep schools safe, masking in schools, absolutely, distancing, cohorting, testing in schools to decrease transmission. Indeed, we are seeing a concerning number of children who are getting sick from COVID-19. But in many of those cases, and in most of those cases, it is because these prevention measures are actually not being taken.
Let's talk a little bit about the Moderna vaccine. The Washington Post reports the FDA and the CDC are looking into the Moderna vaccine and the very small risk of myocarditis as a side effect. What exactly triggered this investigation?
So we have a robust safety system for our vaccines, and several months ago, we noted an increased number of reports of myocarditis with both of the mRNA vaccines, and that is where we updated, we worked with the FDA to update their label indicating this risk. I do want to emphasize that the risk of myocarditis from a COVID-19 vaccine is far less than the risk of myocarditis from the disease itself. And so while we have updated the guidance, the label for these mRNA vaccines, and we continue to encourage people to wait for the third boost because of these safety signals that we want to have the FDA review, it is still much safer to get the vaccine than it would be to be at risk for COVID-19.
Yeah, as we keep saying, the benefits of the vaccine far outweigh the risk. I think the question on all of our mind, when are we going to get out of this? How exactly do we get out of this? Is it testing? Is it vaccines? What is the pathway?
In my mind, the pathway is to unify as a country and to do the things that we need to do to protect each other, protect ourselves. So that is all of the strategies that we have. We are empowered now with a lot of strategies to get out of this. Vaccination is certainly one of them. We still have 100 million people who are eligible for the vaccine who have not taken the vaccine. Prevention strategies, as we know, the masking, the distancing, the hand washing, ventilation in schools. We can move together against this common foe, the virus, not one another, to end this pandemic. And that is what I think we need to do as a country.
All right, vaccines, prevention, and I assume testing as well is a big
Testing
element. One last question. What guidance should we expect in the coming days to be reevaluated given this week's new vaccine effectiveness data?
We are absolutely following the data in real time. The data that we published this weekend that will be coming out next week are vaccine effectiveness data that were really up to the last week or so. We're following data on disease, on infections in vaccines, on disease severity in children, and we will be following those data and updating our guidance as soon as they are available.
All right, well, we look forward to that. Dr. Rochelle Walensky, thank you so much for joining us.
Thanks for having me.